Hello and welcome to the very first Fireside chat hosted by eMHIC. This is a fantastic opportunity for us to come together as a global community and talk about special areas of interest in digital mental health and to take a global perspective on important topics. My name is Gregor Henderson and it's my great pleasure to be hosting this chat and conversation today. I'm a board member of eMHIC and was the former director of mental health for Public Health England in England. I now work as an independent consultant and advisor on mental health and have a portfolio of work in the digital space. One of the organizations I work for is TogetherAll, a 24/7 peer support platform that's clinically moderated with a reach across the globe to a population of around 20 million. Today, we're diving into a fascinating topic, how different countries approach policy and strategy when it comes to digital mental health. It's about searching for that sweet spot where good national governance leads to great outcomes for people, families, and communities. And our conversation is going to cover some key areas, including what are the key elements of digital mental health, governance, how implementing digital mental health solutions can benefit a wide range of organizations, and what are some of the secret ingredients of making sure that everybody has access to good digital mental health. So today's webinar, before I go through the next introduction, let me say that we have a fantastic panel who are going to help us look at how you integrate digital mental health with national policy and what's going to help next in creating and achieving good governance for digital mental health, not just globally, but nationally and in your local areas. As you know, eMHIC is dedicated to implementation, and if digital isn't working for people, families, and carers, then it isn't working. And I think one of the things that we have observed time and time again is the opportunity to learn what's happening in other jurisdictions, to take that learning, apply it nationally, but also locally. So there's a great phrase that Anil and colleagues at eMHIC use, which is called going global, thinking globally, but acting locally. And to help do that, what we have today is an amazing panel of experts who are joining us, who are leading the way in their own jurisdictions, but also someone who is seeing a number of jurisdictions around the world and has that global perspective. I'll introduce our first speaker in a moment, but first there's a little bit of digital housekeeping. We're curious to know where everyone's joining us from and what brings you here today. So if you want to share, please add your country, organization, or areas of interest next to your name by clicking on the three dots on your name tag and selecting edit. It's also a great way for you to connect with others on the call who share your interests. Questions, if you have a question, please feel free to post it at any stage during the webinar in the chat box. And when we reach the Q&A section about halfway through our proceedings today, I'll do my best to pose as many of your questions to our speakers as possible. And just to let you know that today's webinar is being recorded and we'll be sharing the recording in the eMHIC Knowledge Bank soon. So just a reminder, you need to be an eMHIC member to access all the fantastic content in the Knowledge Bank. So if you're not a member, please click on the eMHIC website and join as soon as you can. There are great benefits of membership. But first of all, thank you very much for joining the conversation, wherever you're joining that from. And a big shout out to my eMHIC colleagues and the team in New Zealand, who I think it's 2 or 3 a.m. in the morning their time. That is dedication to the cause. So thank you very much, eMHIC colleagues. Now, it's my great pleasure to introduce our first speaker for today. And our first speaker is Chris Wright, the National Advisor for Digital Mental Health in Scotland. Chris is a system designer, technologist, and expert in the field of digital implementation and mental health. And in a career spanning over 20 years, he has led a number of breaking and award-winning service transformation programs that have changed fundamentally how mental health treatments and supports are delivered across the population of Scotland. For the last 8 years, Chris has held significant and influential national roles within both the NHS and Scottish Government, and is currently working in the government in Scotland as a national advisor for digital mental health and as the head of the digital mental health programme, which he established in 2020. Chris, it's wonderful to have you here, and you're going to give us an introduction to what's happening in Scotland with good governance to achieve great clinical and population outcomes for people in Scotland. Thank you, Chris. Over to you.
That's great. Thanks very much, Gregor. Yeah, so just a wee bit about myself. So I've been working in the field of digital mental health since about 2002. So I actually predate the words digital mental health. So we didn't really use that term back in the day. And really, I've been on a 20-year journey to get to where I am. And my role now within Scottish Government, and I've had this role for about 3 years, is really to bring two worlds together, to bring digital and mental health together, to really have one common goal across the development of mental health services that have a digital component. And to do this, really, I sit in two camps, which is really unusual for an advisor in Scottish Government, where I sit within the Digital Health and Care Directorate, but also within the Mental Health Directorate. And my two roles allow me to firstly advise and influence policy. And what we're finding now in Scotland is digital mental health is appearing in a range of major policies and strategy documents now across Scotland, including the new mental health strategy, which is going to be launched later this year, but also the refreshed digital health and care strategy. And this is really the first time we're beginning to see that digital mental health is really penetrating into policy. And there's been an acknowledgement across Scottish Government that digital is now an integral part of how we're going to deliver services across mental health in the future. So real progression, I think, across the last 3 years, and particularly accelerated through the pandemic process. My other role, which is really interesting, is I lead the national programme for digital mental health. So this is a Scottish Government programme, and as such, the governance for the programme is embedded into government structures. And what we're able to do is really report into quite significant policy areas, as well as significant implementation governance structures across Scotland. And it really provides us a platform to not only influence how digital mental health is being implemented across Scotland, but also influence funding, as well as influence the approach that's taken and actually the scale of delivery, which is really significant at this point in time. The Digital Mental Health Programme has 6 work streams, one of which is our digital services. And digital services really focus on the delivery of clinical services integrated fully into not only clinical practice, but clinical models of delivery. So we use the step care model as a foundation, really, to identify a range of technologies that could be integrated into service, which then provides access to digital therapeutics, as well as video-enabled therapies and a whole range of self-management options. At this point in time, we deliver around about 26, 27 digital therapies across the whole of Scotland. So it's a nationwide approach. We have evidence showing that there's a large scale pickup across all areas, including the very remote and rural areas. Currently, we receive around about 70,000 referrals into our digital therapy services. And just to give you a level of context, that means for every 3 referrals to our psychology services in Scotland, 1 is now digital. And what we're finding is the trend is increasing, and we anticipate that before long will be comparable to face-to-face treatments and group therapy treatments. Across work around our video-enabled therapy, which is using video to facilitate consultations, we have approximately 19,000 consultations per month at this point in time. And we're currently rolling out our group therapy platforms, which will allow us to not only deliver groups within regional areas, but with the potential to actually cross regional boundaries and territorial boundaries and begin to deliver groups from large populations such as Glasgow into very remote and rural areas such as the Shetland Isles in Scotland. One of the other key areas of work that we've been really looking at is around digital enabled self-management. And this is a new and emerging piece of work. And I'm sure all of us on the call will understand that the sheer scale of digital apps, for example, is about 40,000 in the UK just now for mental health. Really makes it difficult to kind of navigate that as a user or as a patient within mental health services. What we're beginning to look at really is a national approach to to not only the implementation and assessment of self-management, but also then ensuring that this is fully integrated into our clinical care and really used as part of our clinical treatments and supporting patients moving forward. One of the other kind of areas of work that we're looking at just now is around remote monitoring. And again, this is something that we've looked at a number of times, but we're starting relatively small with this, but we do have an opportunity in Scotland to roll out something nationally, which will allow us to collect clinical outcome data, as well as begin to monitor patients a lot more closely in their own environments, which is a really interesting and exciting piece of work. Interestingly enough, I think within Scotland, the policy direction of government is to move to much more preventative approaches. And the new mental health strategy is going to reflect this with a 3 Ps approach, which is promote, prevent, and provide. And I think digital is going to play a really significant role across all of those 3 areas, which again is really providing us an opportunity to not only create more sustainability in what we're providing, but actually expand the digital offering across mental health. And this is really being bolstered by a general acceptance across clinical and patient populations that digital is a significant integrated aspect of how we deliver services, but really adds value into our clinical and care services moving forward. So to ensure that we're delivering a sustained digital service offering, we're beginning to develop a sustainability framework in Scotland, which is really looking at not the digital services as such, but actually beginning to look at things like workforce and training, but also equality and inclusion and assessment of products and various other elements, which will ensure that there's a higher degree of sustainability, and really trying to move away from a program model where we're looking at temporary structures to facilitate the growth and development of digital into something a lot more sustained longer term. And this is a really big part of this is the development of innovation and an innovation environment. And we've developed in Scotland a digital mental health innovation cluster, which is really trying to pull together a number of key elements, including academic, industrial, and clinical partners to really provide the environment of collaboration and support and partnerships, so we begin to develop and influence the development of products in the areas where there's a genuine need. Also products that meet our needs in relation to standards, clinical evidence, and obviously things like risk management moving forward. And it sounds like a really rosy picture in Scotland, but I can assure you that we have our challenges, as all areas do. I think in the current climates and cost of living issues, we do have financial instability. So it's really, really key for us that we're beginning to build a lot more financial stability into our longer term planning, but also the ability not only to sustain what we have, but to grow and develop beyond where we are just now. We do have issues around clinical leadership as well as service leadership. And again, this is based on capacity pressures, but also maybe looking at how the workforce has developed over many, many, many years, where digital has always been seen as a slightly additional element to clinical practice or to care practice. So really important that we begin to build up our leadership across Scotland a lot more predominantly. I think one of the interesting things that we're coming across is really the implementation of new technologies. And in Scotland, our digital therapies, for example, still use predominantly old technology. And the use of things like gamification, AI, and virtual reality still seems quite far off in terms of the journey we're taking across our digital services. So again, it's going to be really interesting as we begin to develop a more sustainable structure. How do we ensure new technologies are actually integrated fully into clinical care or into our care services moving forward without the need for large-scale programs or large-scale implementation approaches? And I think that's going to be the challenge over the next 5 to 10 years for us in Scotland. And one of our biggest issues is really around transformation, cultural change, as well as system capacity. And you'll know yourselves, I'm sure it's the same across many, many of our countries, our health and care services are under a massive amount of pressure. So even just finding time to implement new technologies or test new technologies in live environments can be really, really challenging. And this is something that we are trying to overcome on a kind of ongoing basis. I think if I was looking at a general reflection across the Scottish health and care system, though, there's been a real recognition of the value that digital mental health is bringing across the wider system. And this is really providing us with a lot of opportunities in the next couple of years to really progress the overall agenda in Scotland. But what I would say is key is that what we're doing is taking people along with us. And that's including a range of clinicians, clinical populations, but also the Scottish Government and the policymakers. And I think it's important that we're targeting all areas to make sure that this is genuinely created as a sustainable structure moving forward. Thank you very much.
Chris, thank you. That was great. Really, really impactful. And wow, you packed a lot into the 5 minutes there. So thank you very much. Lots more opportunities in the panel discussions to have an interaction with Chris and our other colleagues. So thank you very much, Chris. Great to hear about what's happening in Scotland, my home country. So that's always great. So let's move on to our next speaker. It's my great pleasure to introduce Nicholas Waters, who's the Director of Access to Quality Mental Health Services with the Mental Health Commission in Canada. I've known Nicholas for a number of years now, and I'm really, really impressed by not just the things Nicholas does, but the manner in which he does them. And Canada is a great place for innovation and creativity. So I'm looking forward to hearing this. Nicholas leads multiple portfolios with the Commission aimed at ensuring that those living in Canada have access to equitable, culturally safe, appropriate, stigma-free, recovery-oriented mental health services and supports, whenever, wherever, and however they choose. So he's a massive fan of digital. He's also part of eMHIC, the eMental Health International Collaborative, Global Leadership Council, and a member of Health Canada's Digital Health Equity Working Group. In 2022, I was there when Nicholas received his eMHIC Lifetime Achievement Award for eMental Health Development, Implementation, and Forward-Thinking Leadership. And prior to joining the Commission in 2011, he was a senior advisor for knowledge transfer and communications at the Chronic Disease Prevention Alliance of Canada. Really looking forward to hearing from you, Nicholas. Over to you.
Thanks so much, Gregor, and it's a pleasure to be here and really look forward to the discussion. So before I start my remarks, I would like to acknowledge that the Mental Health Commission of Canada's head office is located on the unceded traditional territory of the Algonquin Anishinaabe Nation, in what is now called Ottawa, Ontario. As a national organization, we acknowledge that we work on the traditional lands of many different nations, and we give credit to their stewardship and sacrifices and are committed to recognizing and contributing to new and respectful relationships with First Peoples. For those of you who don't know about the Commission, we lead the development and dissemination of innovative programs and tools to support the mental health and wellness of Canadians. Through our unique mandate, the Commission supports federal, provincial, and territorial governments, as well as organizations in the implementation of sound public policy. The Commission is also now a registered charity. In addition to our federal mandate, we partner and receive funds from provinces and territories and other organizations to advance access to quality mental health care for those living in Canada. At the Commission, all of the work we do is in partnership with those with lived and living experience. It's a crucial part of our work to co-design projects and resources with stakeholders right from the onset. One particular group of stakeholders that is really vital to the success of the Commission's efforts in eMental health over the past decade is the eMental Health Collaborative, which is a group of 25 global leaders and subject matter experts, including policymakers, those with lived and living experience, researchers, practitioners, system leaders, technical experts, and those working in both the for-profit and not-for-profit fields in Canada. As I mentioned, the Commission has worked in eMental health for over a decade and has developed innovative research, policy documents, implementation supports, evaluation tools, hosted many different events, and helped spread and scale transformation initiatives. So today, in this intro, I'm going to cover two in particular: our work on Step to Care 2.0 and our work in app accreditation. So back in 2016, the Commission launched the National Request for Proposals to identify, scale, and spread a system transformation initiative that blends both eMental health and traditional in-person service delivery. The grant was awarded to Dr. Peter Cornish and his colleagues to work in collaboration with the Commission to scale and spread Step Care 2.0, initially in the province of Newfoundland and Labrador, to 15 mental health and wellness clinics and 2 primary care clinics. Step Care 2.0 was developed by Dr. Cornish as a transformational model for the delivery of mental health and addiction services, organized into 9 steps, which can be populated with diverse care options depending on the location. The person-centered, strengths-based approach provides rapid access, same-day, flexible access to evidence-informed wellness and mental health services that are aligned with recovery principles. Because the failure to meet the need of mental health comes at such a high cost, StepCare 2.0 offers people access to the help at the point of need and the point of readiness. During a person's first engagement with StepCare 2.0, they receive an intervention to address their primary concern and are supported by a community of care. In the Newfoundland and Labrador demonstration project, about 80% of clients reported that lower intensity options, such as eMental Health, met at least some of their needs. And during that 2-year project, it helped to reduce wait times in the province by 68%. So a significant number. And that success in that initial implementation has led to multiple implementations in 4 additional provinces and territories with some similar results. Now I would like to switch gears to our work in app accreditation. We know that mental health apps can and should be part of the future of mental health care, as they provide options for those living in Canada or globally to access cares and supports where, how, and when they choose. But to do so, we need to ensure that those accessing and delivering care can trust the mental health apps are high quality, effective, and appropriate. For example, there was a review by the Lancet Psychiatry in 2016 that investigated the top 700 mindfulness apps in the various app stores. And what they concluded was that only 23 were actually providing mindfulness training, while only just one, was based on empirical evidence. We also have examples of suicide prevention apps that use the wrong crisis line number. Of course, a very dangerous example that could have dire consequences. So that being the case, in the winter of 2020, we prioritized this area of need by initially commissioning work to review the current state of app assessment and evaluation tools globally. And since 2020, we've completed an environmental scan and our literature review, which helped us identify ORCA, the Organization for Review of Care and Health Apps, which you'll hear from next, who we've been partnering on this work ever since. So since 2020, we've engaged hundreds of stakeholders through a variety of methods, including roundtables, focus groups, topic-specific working groups, surveys, and a public review. And what that led to was the development of the Canadian App Assessment Framework, which is comprised of 7 different areas of focus, which we are calling standards. And then within those standards, there's criteria that apps need to meet. So there's roughly 450 plus criteria that each app will be assessed against. And those standards are data and privacy, clinical evidence, clinical safety, usability and accessibility, security and technical stability, cultural safety, social responsibility and equity, and enhanced data sovereignty. And that last domain of the assessment framework adopts the Canadian Institute for Health Information's minimum standard for collecting race-based and Indigenous identity data in healthcare. We are now in conversations with multiple provinces and territories to develop digital app libraries for their populations. We believe it's such a vital next step to ensuring that anyone living in Canada has access to high quality, effective, safe, and culture appropriate apps as part of their continuum of care, when, where, and how they choose. And now we are also in the development of an eMental Health strategy for Canada, which we'll learn more about during the discussion today. And so now I will turn it back over to Gregor, and thank you.
Nicholas, fantastic. Thank you again. Absolutely hugely insightful, and again packed a lot in there. I'm really taken with the web assessment, the app assessment. That's great. Keep the conversations going in the chat. We've got some great participants around the world. We've got people from Australia, Ireland, Sweden, Canada, the UK, US, Norway. So if you haven't said hi in the chat, please do so. And also please flag any themes you're interested in exploring, some of the things that you're interested in looking at, and also post some questions for our panelists. And we're only one presentation away from the panel discussion, so let's see what is on your mind. Okay, it gives me great pleasure to introduce our next speaker, Liz Ashell-Payne. and the founder and CEO of Orca, which you'll hear a little bit more about. I've known about Orca and I've known Liz for a while. We tried to do some work together back in Public Health England, and that would have been amazing. But sometimes, hey, procurement doesn't always work the way that you want it to. And that was Public Health England and England's digital advancement, I think, lost. But Liz, you've been doing some amazing stuff, not just in the UK, but globally. So you're going to give us a global perspective. Let me just tell you a little bit about Liz. As I said, she's the founder, the co-founder and CEO of Orca, which is the world's leading provider of digital health accreditation and distribution services. She's a trained speech and language therapist for almost 20 years. Liz led transformation programs across the UK, Europe, and North America, helping to unlock the power of digital across the UK and internationally. In 2015, Liz founded Orca. The organization has grown exponentially and now provides digital health assessments and distribution services in 12 countries and in the UK to organizations in 70% of the country. Orca has won numerous awards, and Liz has been selected as a tech trailblazer by BIMA 100, picked as a healthcare IT leader by the HIMSS Future 50. You can translate that for us, Liz. This one I love, named Northern Entrepreneur of the Year by the Northern Powerhouse and Ernst & Young, or EY as they're known now, and is featured within the LDC Top 50. God, Liz, if you were a pop star, you'd be on the Billboard and the UK thing and the UK charts. Liz was appointed an NHS England NIA Fellow and is Vice Chair at the Tech UK Health and Social Care Council. Liz, can't wait to hear what you've got to say. Over to you.
Oh, thank you so much. And that was a really lovely introduction. So thank you, Gregor. I do have some slides that I wanted to share with you, mainly because I'm a visual person. And so I enjoy being able to share some pictures with you. So I'm going to just share my screen. Hopefully, somebody can just tell me that they can see that. So as Gregor said, I started out my career working as a clinician and specialised in complex paediatric care. And people quite often say, well, how did you go from being a clinician to running an organisation like Orca? And the honest and very direct answer is because I knew that as a clinician, I could only see one patient at a time. And I got really interested in thinking about how we can provide more access to great healthcare services for people and patients. And that when I first started working clinically, digital and technology wasn't a thing. We wrote our notes, everything was done on paper. But fast forward 15 years and you start to see the rise of the smartphone device and health apps. And I thought if we can just provide access to great, effective digital health technologies and put them in the hands of people who've already bought the smartphone device, then we can help more people have access to healthcare. And that's where the challenge started, because then I got obsessed with, well, what's the problem? So I'm going to tell you a little bit about that story and then also talk about how you can establish strong governance, which is really important because we've already heard from Nicholas about some of the challenging technologies that are available to our populations. So if I just zoom out and just share with you a global view of what the opportunity is within digital health technologies. So there are currently about 360,000 digital health technologies. I think it was Chris that commented that there are over 40,000 digital health technologies for mental health. What we also know is that there are lots and lots of people who have smartphones. In fact, there are more smartphones on the planet than there are toilets or toothbrushes, because a lot of people have two. And people even living in very remote areas also have smartphone devices. What we also know is that every day 5 million people will download a health app. And looking at that data, mental health is one of the prominent areas for people searching and using digital health technologies. We also know that our healthcare professionals want to engage with technologies. And what we also know is that age isn't the barrier it once was. The map that you can see there is showing you the top countries for health app downloads. So it's really interesting just to have a look at who's downloading technologies on a global scale. So the question then comes is, if we have this huge opportunity, why are we not embracing these technologies? Well, this is the ultimate challenge. Only 20% of digital health technologies meet the criteria and quality that you would expect. And what that means is that for the 5 million people who download a health app every single day, most people are finding something unsafe or ineffective. Of course, trust is the biggest barrier, but it isn't the only barrier. There are other barriers which are really important to think about. So the first thing, actually, before trust, is awareness. Our healthcare professional communities, me as a clinician, we're not aware of what technologies are out there, and that's because we're not trained in them. Now, once we become aware that there are all these technologies out there, the next thing that we have to face is, how do we access these technologies? There isn't a long list of those 40,000 mental health apps. And actually, that isn't what we want to access. We want to access the right technology for the patient we're trying to support right now. And so we need a mechanism to be able to search and filter to find the right technology for the person we're trying to help. And once you've found a technology that you have accessed, you need to be able to trust it. How do you know that this technology is safe today and effective? And if I recommend it, what happens if it changes tomorrow? And that leads me to the governance element. How do you make sure that there is a clearly governed infrastructure that allows for safe distribution and recall if it's required? And so the analogy that I wanted to talk you through today, just briefly, is where the idea for Orca came from. It came from thinking about, how do we distribute other things in healthcare safely and effectively? And a real obvious place to think about that is in the distribution of medication and pharmaceuticals. And if you think about what happens before a drug gets to market, there is a clear licensing process, and this is about generating trust. So that licensing process here in the UK, it's MHRA, and then NICE, who are looking at the effectiveness of that medication. And then that information enters into the curriculum for would-be prescribers. And prescribers are then trained in these drugs, not just in individual drugs, but where in the pathway they need to be embedded. We then have access to medication formularies. We then have a distribution, a prescription infrastructure that allows for safe prescription of drugs. And that wraps up governance, because the system now knows what drugs have gone where, to whom and when. And that's what Orca have built over the last 8 years. We run evaluation services. We work with our partners to make sure that that trust is established, and you can run it to different requirements. So Nicola shared the requirements that Canada are focusing on. A lot of it is quite similar to other international standards, but there are also some differences. Of course, that evaluation needs to be ongoing. Just doing it once isn't enough for technology. The next thing is, you then need to put that information into a curriculum. So we've built the Digital Health Academy, which means that clinicians and medics can now go and do training and go and take over modules which are clinically specific around pathways. What they then have is access to digital health formularies, which are filled with safe, effective technologies. And for people and patients, they have a promoted digital health app library. So they now have a safe place to go. For the formulary, there is also the prescription infrastructure, or the recommendation infrastructure, which is sending a technology direct to a patient's phone. Wrapped up in that is therefore governance. The system knows what's gone where, to whom, did they download it, and the re-evaluation is really important here, because if a future fault is found, a recall can be established. And I just wanted to share with you a quote from Anders, who's a chief exec who works across the Nordic nations. And he said to me, unlocking the power of digital health is not about a standard, it's about a system. And for me, that's what governance is. So thank you for listening. Looking forward to the panel. You're on mute.
Of course I was on mute. Terrible. Okay, Liz, that was amazing. Thank you. Again, covered a huge amount of topic areas in a very short period of time, but thank you very much for that wonderful resonating quote at the end from Anders. That's great. We've had more people join us. We've now got people from Austria, so welcome to those in Vienna. And also, please post some more questions. I've got a couple of questions that I've taken a note of, one from Elaine and one really nice question from Ananya, which some of you in the chat may be able to help with, looking to get into tech and before applying for a PhD program. So fantastic to have young future leaders with us. Okay, so we've heard about some truly amazing work going on in this space. Let's dive a little bit deeper into the topics. Can we have Chris and Nicholas back in? And I'm going to try and moderate a short panel discussion and then open it up to questions with you, the audience. So, okay, well, one of the questions that I had, and they were great presentations, is, and Chris, you kind of sparked it, and then Nicholas, you made me think more about it, and Liz, your conversations made me think a little bit, wow, how would you assess that? So Chris, you talked about, things may be a little bit more concentrated in terms of the mental health service sector on the clinical dimensions of digital mental health. We're all working across all of our jurisdictions on, as we know, more integrated agendas, looking at prevention, promotion, early intervention, engaging other areas, government departments, other colleagues in housing, employment, etc. And this opens up a really interesting and fertile field for digital, particularly in prevention. How are you marrying sometimes the issues that can come up against clinical, not versus prevention, but bringing prevention and early intervention into the mental health landscape in the digital world? It's hard enough doing that in the traditional mental health space. But give us some insights into how you're encouraging people to think not just clinical digitally, but prevention and promotion and population digital.
It's not a small question. So I guess the first thing I'd say is you have to encourage integration. And I do mean integration of digital into clinical practice. And I think Liz touched on it before. We have massive clinical structures across all of our health and care services. And actually we have to utilize those as digital providers ultimately, and make sure that what we're doing is not seen as a separate entity. So the first thing is to make sure that we are integrating into it. And then I suspect what we're doing at a kind of government level and then as a policy level and then moving into service delivery is making sure we're all going the same journey around prevention. So prevention isn't just about digital, although I think digital probably has the biggest role in prevention in many ways. It's about making sure that all of us go on the journey of prevention and moving towards a self-managed model of care. And I think for us, it's a necessity. I think that the reality is we have to ensure that clinical services and others are aware that there's now a necessity to move your health and care services into a more preventative model of delivery, because we just don't have the capacity either digitally or in more traditional approaches. And then I think what is the role of individuals on the call today, for example, and the digital leaders, is to make sure that digital takes its rightful place on that agenda and make sure it's fully integrated into the process of developing prevention and self-management more.
That's a perfect answer. I love that, because I think it is also up to policymakers, and they need to be digitally literate as well in how they speak. And if you're in the UK, you'll have read the Hewitt Review, which is calling for year-on-year 1% investment in prevention from the NHS. Interesting. Nicholas, let me take you into this, because during COVID, Canada and a number of jurisdictions really pivoted very quickly and used digital as part of that pivot. And you were doing some great stuff on well-being, you were doing great stuff on communities. Has that bounce into the prevention, into early intervention space maintained itself in Canada so that digital is doing that full integration that Chris was talking about?
It's an excellent question, Gregor, and I do think integration is key. One of the pieces that you were speaking to about, with the leadership that Canada took during the COVID-19 pandemic is that we created the Government of Canada, not the Commission, we partnered on it, but Wellness Together Canada, which is the one-stop shop for people to receive mental health and addiction services and supports that day. And it's so interesting that we've been talking about how digital has worked for years. And of course, we know that the pandemic just enhanced and sped up the process. But Wellness Together Canada is still available to everyone living in Canada. If you need services and supports, you can log on or you can go onto the site and then you can speak to someone that day. You can actually also just get, wellness supports and others. But it's so fascinating because people weren't expecting to be able to see someone that day. And so one of the biggest, pieces of feedback was, oh, well, I'm not ready. So then, of course, you could use other digital mechanisms like apps or the wellness supports that are available. And so I think it's always the tension of the, us versus them or the either or. But as Chris mentioned, e-mental health needs to be part of the continuum of care and give people the choice of what works best for them, depending on what stage they're at, where they live, what time of day it is, all of these things. So I'll turn it back to you, Gregor.
I mean, that is great. And I think, a lot of digital provision has seen what we might call a COVID bounce. My question is whether or not that bounce has been sustained. I mean, I was speaking to someone in Australia the other day, and they were doing virtual wards. And for some people and families, virtual wards at home meant they could go about their business and still be seen and still be getting really high quality care. But when COVID stopped, the virtual ward stopped and people were going, hang on a minute, I've had something I really like. Why is that being taken away from me? Liz, can I bring you in? Because, with you span the whole accreditation and issues around, and I want to move into issues around safety and quality. What would be your advice to people on the call around how do you manage that whole integration agenda from promotion, prevention, early intervention, brief distress, right through to, clinically frontline service provision digitally? How do you get the safety and quality assessment right on that?
So I think there's two parts to that. One is what are you evaluating against? And the second is who you're distributing the evaluated technologies to. So I'm going to start with the latter rather than the former, and then I'll come to the former. So the latter is you need to be really clear about the problem you're trying to solve. So and everything hinges on that. So if the problem you're trying to solve is that you've seen, we know that we're seeing more young people attempt suicide and self-harm and enter into urgent care at point of crisis. If that's the problem you're trying to support, it's then about looking at that data. Are those people who are experiencing those challenges people who are known to a healthcare system? If the answer is no, you need to work upstream and think about where those young people are. They're in schools. They're not going to their primary care practice and seeing their physician. So it's about engaging with the schools to say, how do we use the schools to activate those young people to search and find these technologies that can help them to prevent crisis. Of course, another problem might be post-intervention. At point of discharge, people don't maintain health outcomes and they come back round the revolving door. If that's the problem, actually the touch point there is the discharging practitioner. And what we know is if a trusted person deploys a technology and recommends a technology or refers somebody to a technology, you are significantly, and I mean really significantly, more likely to get them to use it. So independent people will find about a 10% conversion rate post the recommendation of a trusted person. It could be a teacher, it could be a health or care professional. It's about 78% conversion. Now, then you talk about, well, what are we evaluating against? I mean, Nicholas touched on some of those elements around data privacy, data security, clinical and professional assurance, usability, accessibility, cultural, etc. The key thing here is proportionality. So if you've got a technology that is very low risk, so it may play relaxing music to meditate to, that's a low risk technology, versus something that may be looking to diagnose or give you information at point of crisis, they're very different risk profiles. And therefore the level of evaluation that you go into needs to be proportionate. I would take up the rest of this session if I tell you exactly all the detail, but if anybody's interested, very happy to share more details after.
Yeah, good. And I just we might explore further around a line around some really innovative ways of thinking about this. But I do think safety and quality really matters. And I think, you know, what we're seeing is a lot more jurisdictions now looking to step into the regulation space. It may have been in the past, just let things happen until something goes wrong, and then we can look at whether or not and how we step in to regulate. But I think we are going to see a little bit more around assessments, quality standards, safety and quality. And I think if you know, Liz, back to you just quickly, is there a jurisdiction that you think has got this right, getting it righter, or actually having done some good things, or maybe has started something and it might be down the wrong track? We were talking about this the other day.
So I mean, I think that as I said, the last quote that I said in my presentation was, you need a system, not a standard. I think for a lot of jurisdictions, they've got stuck on creating a standard and then stopping. And it's the connected system that will create adoption of these great technologies, because until you've got the system in place, it's been an interesting, I suppose, almost academic exercise to find out which technologies are good. And I think that what we've seen is that different jurisdictions are at different points on that journey. Of course, the first question you do need to answer is, what does good look like? And then the next is, how we're going to get it to people who we can help. I think, you know, a good example, which is cited quite often, is the work that's done in Germany with the DIGA. They've made some massive strides forward. They created the DIGA, which was their standard, and then they enabled post recommendation. They put a law together which said if a doctor recommends a DIGA compliant technology, that the health insurer will have to pay for it. The bit that was missing was that system. How do you activate the healthcare professional to distribute these technologies? And that's been the missing jigsaw puzzle for them. And maybe I would say this because we work with Nicholas, but I think the thing that Nicholas and his team have done in Canada is they've thought through the strategy in full before starting. And I think that it's a bit like the tortoise and the hare. That will get you there faster in the end, in just thinking through a connected system rather than thinking it's about a standard. I hope that makes sense.
It does make sense. It does make sense. Chris, can I come to you quickly around innovation? You know, some people think that governments are there and then they bureaucratize things. It's not what I'm seeing when I look at governments and digital mental health, particularly so in Scotland. You have this innovation cluster. How are you supporting innovation? How are you able to kind of discover things, develop them and deploy them? What's the process you're using to get people kind of excited about the innovations coming out of digital?
So I think the first thing is almost being like a parent, which sounds a bit odd, but it's about encouragement without stifling, ultimately is what you're trying to do. So you're trying to encourage innovation, maybe give it a wee bit of guidance. And I think Liz's point's very well made here is, when you look at technology, there has to be a need for it. Ultimately, there has to be a real reason why you're implementing it, and there has to be an outcome to implementation process. And from that outcome, you'll get the biggest buy-in ultimately for large-scale implementation. And it also has to fit. So it has to fit in with what you're trying, the environment you're trying to make it work in. And I think, interesting enough, things like risk management have to work well, and so on and so forth. And a lot of our innovators will develop amazing technologies, but they just will not work in a practical sense within a health and care setting. So what we're trying to do in Scotland is really create an environment where we're creating collaborations between academic, industrial and commercial partnerships, industrial and clinical partnerships or care partnerships, which then we're able to then begin to shape the technologies a lot more. And I think the first thing is what you do is you get a lot greater buy-in, because you'll have buy-in from academic institutions where you have the research and the evidence that's generated, but you also get buy-in from the health and care systems when they know that people have been involved in it. who are their kind of peers or people that are working alongside them. So I think that really helps an awful lot. But ultimately, I think you also have to have a long-term vision of how innovation will work, because I think we know the technology, there's a massive amount of technology being developed every day, fantastic technology being developed every day, but we're predominantly using technology that's 5 or 6 years old. Ultimately, that's what it comes down to, because it has an evidence base and it has credibility and it has various other things. And ultimately, I think the position we have to get to is that full implementation pipeline. So it's not just about the innovation being developed and stopping at the point where the company takes it as far as they can across the innovation pipeline and then it cannot transition into the kind of large scale implementation. And I think it's really important. I don't think we've quite got this right. And I'm sure it's the same in many, many areas. But what we do have in Scotland is we have a process that you can go through to get to national implementation. But the entry point is really, really high. The evidence requirements are really, really high. And the standards that you have to meet are really, really high. And they're probably not proportionate to some of the technologies we're trying to implement. So it's about getting the right balance. But ultimately, I think you have to take a whole system view of the implementation of innovation across large scale. So not looking at pilots, not looking at test change, but looking at national implementation and understanding what the needs are for that national implementation, and then providing enough guidance to the industrial partners who are then developing technologies to get them on the right path, make sure they're collecting evidence right from the beginning, make sure they have the right people involved so they can get a level of accreditation, and make sure they go through getting themselves into a state of readiness for deployment in health and care systems.
Very good. Liz, there's a question coming in the chat, so thank you. I'm going to now go to questions from our audience or participants. We've got a few coming in, so I encourage you to look at the questions, Chris and Nicholas, and see if there's anything they'd like to pick up. Liz, this one's for you. It's from AT. Hi, AT. I'm intrigued what factors have motivated the 12 nations that you're working with to go down the path of accreditation and activation of e-mental health solutions. So, Liz, if you were putting together that wonderful dozen, what is it that's motivated them to take this leap into digital e-mental health?
Yeah, so I think it's probably broader than the jurisdictions that we're working in, actually. The reason is the answer is quite simple. It's that there's two ends, there's a push and a pull. So the push is that capacity and demand have never been matched when it comes to mental health services. So we've never had enough capacity to deal with the demand that's presented. And of course, we now know that to be even more of a significant challenge than it was, because we've seen a significant rise of people struggling with their mental health. That, alongside the rise of the smartphone device, digital health technologies, and the opportunity it presents, means that jurisdictions are looking to embrace the opportunity. And the public being so ready to accept digital health, and in some instances more interested in having digital health than having a face-to-face consultation for some demographic profiles, means that it's the right thing to do. And what it means is that we can offer healthcare in a different way. And I would say that the challenges from a mental health perspective and the opportunity when it comes to digital mental health is a global one. And I would also say that most of the jurisdictions we're working with are specifically looking at mental health. There's also a nod to elective recovery and people waiting for surgery. But of course, mental health, the impact on mental health is there as well in those situations.
Yeah, great. And I think I was talking to someone recently, they were talking about open access to healthcare. And, the digital world opens that up as long as it's properly monitored, regulated, and the standards are there.
Absolutely.
Chris, Nicholas, have you been able to look at the chat? Will I pull something up? And while you're looking at that, Nadia, I hope I've got that pronunciation right, would like not just our speakers, but people on the call to think about how they can involve Ukrainian professionals and students in their programs of work on digital mental health. And in any way, so absolutely, Nadia, we stand in solidarity with you and all of your colleagues in the Ukraine. So if there's anything eMental Health International Collaborative can do there, I know they have had interactions with Ukraine. So our hearts and our thoughts go out to you. And if anyone on the call wants to help with that, then please get in touch with us at eMental Health International Collaborative. And Nadia, we've got your details, so we can try and connect you with that. A question from Tanya about those with neurological and deafness defects since birth, as mental health issues with those two challenges go hand in hand. How would the digital world know if those with neurological and hearing impairments are using the digital side of that? And Nicholas, can I come to you on that? Because I think with app assessment, it's really important that we look at people's individual specific needs. And we know from work that we were doing in the UK that during COVID, a lot of people who were neurally diverse, neurological diversity, really welcomed some of the platforms that were being afforded and some of the platforms that were there. Any insights from Canada around neurological and also deaf issues?
Thanks, Gregor. So I don't have in front of me the stats around usage, but what I will say to your point around developing the tools and products to ensure that they're accessible to people with physical, mental health challenges, disabilities is so important. And so when we built our framework, we specifically paid attention to elements around culture, equity, diversity, inclusion, and building these tools so they can be used by multiple people in Canada that have a various types of different conditions and disorders. Because what we find is often an app that is supposed to be for children and youth, for example, is built by a whole bunch of older adults that didn't engage children and youth. Or if it's for another particular population, it's handed to them as a baked cake. And so what the development process that we took on our framework was very inclusive to ensure that if those standards are being developed, the apps actually have to be developed in partnership with those communities, not as a standalone. And so again, I don't have the usage stats, but just around the inclusivity of the development of technology is so vital. And our framework also built in this type of consultation and conversations, I should say, to ensure how that can be used by developers when they're creating them.
Really good. I've had a great question, isn't it? All the questions come tumbling in at the end. This is a fantastic one, but we literally have 1-2 minutes left. So I don't think we're going to be able to do justice to your question. And again, I hope I'm getting the pronunciation right. Ananya, your question is, while digital platforms for affective disorders, mindfulness, mood tracking exist, research highlights that individuals with serious and enduring mental illness fail to receive the same assistance from the aforementioned platforms. Curious, as we all are, how respective regions and jurisdictions are trying to increase user engagement with those with severe mental illness, or implemented the lived experience of individuals with serious mental illness across existing novel digital health platforms. And all I can say is that there was a great insights into some of that at the last eMHIC Congress. So I think, there's another eMHIC Congress coming up in Sydney next year, bit of an advert, but that's okay. Really, really very good tracks of knowledge and information around how to get digital, lived experiences, and also maybe reach out to people with severe and enduring mental illness. I'm going to have to wrap up. I had one of these classic questions, which was, what would be one parting comment from our panelists, but I'm going to run out of time for that. So let me instead thank our three panelists very much for their really insightful talks and willingness to engage in the conversations and also the questions. So thank you, Liz, Chris, and Nicholas. That was awesome. So we've come to the end of today's session. Big thank you to all of you for joining us and for sharing your thoughts in the chat. Once again, if you're interested in previous webinars, please access the eMHIC Knowledge Bank. And that's for it today. And it's been a pleasure having you all with us. And do stick with eMHIC and whatever you're doing in whatever jurisdiction. The best of luck with everything. And we will see you in another digital universe sometime soon. Looking forward to that time. Goodbye, everyone. And panelists, let's go backstage. But thank you very much, everyone.